In some ways I see it almost as behaviour modification surgery. We try and impart as much information as we reasonably can to our patients about what their experience is going to be like. We try and describe the post-operative journey. I like to think all our patients go in well informed about what they're getting themselves in for.
Our patients stay in hospital for 2 nights. Usually they don't have any kind of special attachments and we get them going pretty much straight away. So surgery perhaps in the morning, up and around in the afternoon, walking, starting to drink. 2 nights in hospital, the next day is just really drinking and walking and doing some breathing exercises, and usually patients will go home on the morning of the 2nd day. I usually tell people to take 2 weeks off work. One of them is to physically recover from the operation. The surgery itself is not a big painful experience. It's done through keyhole incisions, and by about the 3rd or 4th day post-operatively, most patients will just be taking paracetamol and maybe anti-inflammatory like ibuprofen. And often they're very surprised about how good they feel or how quickly they're able to return to normal. So many of them would be driving by the 3rd post-operative day, by the weekend after surgery, doing things that they would normally do around the house like shopping, taking kids to sport. The 2nd week is for their psychological recovery. So I think that adjustment is a really big thing, and it's good to have some headspace to get your head around the fact that you're going to need to drink every 10 or 15 minutes.
So it's 2 or 3 tablespoons of food per meal, and it's regular sipping of water so you get adequate volume in. We're still asking for 1.5 litres of liquid in per day, but it's very important to realise that this is a process in evolution. What you experience at 2 weeks post-operative and 4 weeks post-operative is going to be quite different from where you are at 3 months or 12 months down the line. By 12 months, I'd expect you to be eating at least entree-sized meals for your meal, in addition to drinking really what you feel you need to at any given time. That really emphasises why surgery is a tool. Surgery works very effectively for inducing weight loss, but it's critical to maintain the lifestyle choices that you learn as you readapt to your new eating behaviour so that you don't get weight regain afterwards. By the time you get a certain amount out from surgery, if you choose very calorie-rich, calorie-dense foods, then you can start to get weight regain. So sticking to the lifestyle advice is critical for a good long-term durable outcome.
Some patients recover very well and very quickly after surgery. Some patients take a long time. We're all different and unique and individual. Some struggle, some breeze through, and you've got to accept that those that sort of struggle through the first few weeks or first few months, our job is to get them through that, and that's very important with all our follow-up that we do. We have dietitians, psychologists and surgeons ourselves. We follow them through the initial phases. There's always a bit of a struggle sometimes. As 6 months, 12 months down the line, things get better. You're able to eat a little bit more, things are less of a struggle for them, things get a bit easier. As the weight comes off, they're feeling more energised, they're able to exercise more, they're noticing the differences, they're getting compliments from people, from family and friends, and they sort of notice that they're looking thinner, and then other people start taking an interest in them, and so it becomes their self-esteem starts to build up over time. So by about a year post-op, when their weight starts to stabilise, they're feeling very good about themselves. But it is a journey, and we've got to nurse them through that journey.
And I counsel a lot of people that first 12 months post-surgery is going to be 12 months that the future you is going to thank you for a very long time.